I'm Doug Roderick, and I'm curious what causes a horse to get an abscess in their foot, their hoof?
Hi, I'm Diane Green, and welcome to my YouTube channel, HOOF-RX. I'm a farrier in Redding, California, and I had one of my clients, Doug Roderick, ask me a question about hoof abscesses. I'm going to take you through the process that I use to evaluate a horse that we suspect is going to have an abscess come out of their foot. This horse is Buddy, and it happens to be Doug's own horse. So we're going to get started, and I will tell you how I evaluate to determine if a hoof abscess is going to pop out the top of the foot, which is a gravel, or out the bottom of the foot, which is an abscess. First thing we're going to do is watch Buddy walk and try to isolate where the lameness is. I'm going to have Doug walk Buddy for me so that I can really see what's happening. When Buddy's walking out, I see that he's limping on the left front foot. When he turns, I have Doug turn him first to the right, and then I have him turn to the left in the opposite direction so I can watch him stepping on that foot in the turns. Sometimes a horse will not show lameness on the straights, but definitely on the turn. See how he's crossing over and he's walking real stiff and being very careful about the weight he puts on that foot. Alrighty, here we've got Buddy, and he's limping on his left front leg. So the first thing I want to check is I want to be able to take my fingers and go down and see if I can isolate any sort of bounding pulse. And he's thinking I'm asking him to pick up his foot. So when a pulse is bounding in this area, in the pastern area, that means there's a sign of inflammation in the foot. And I don't really feel much of anything. So then I'm palpating the foot. And what I'm doing is I'm looking for swelling and I'm looking for heat. And I don't really feel much in the way of swelling and heat, which is a good sign. So I'm going to take this foot and Doug had it all nice and clean, but I'm going to go ahead and take my knife and try to clean it up a little bit again. I'm looking to see if there's any place here on the foot that has stone bruising or a sign of an abscess having ruptured through. Now, Buddy was showing lameness. What was it? Friday morning, which is today's Monday. So that was 3 days ago, really hurting on this foot. And then he seemed to get better. And then the mayor got out and he went ape. And now he seems to be better again. So he's definitely feeling something. So I'm just taking my knife, looking for any areas where I see moisture, pus, anything coming out. And I really don't see anything. Everything is looking pretty good under here. So there's definitely something bothering him. And the way he's limping tells me that he's got a tender spot on the foot, but I don't know really where it's at. So the next thing I do is I'll take a hoof tester and I'll start testing the bottom of his foot, trying to isolate where the pain might be. So that is a positive reaction. He is definitely feeling discomfort on that side of his foot. So I'm going to come and do this side. Now, I want to give him a minute because he's anxious. I just heard him over here and he's feeling like, okay, are you going to hurt me someplace else? So now he's just generally acting sore. So where we didn't have any pain up here before, now he's acting like he's anxious about the pressure and the squeezing. But that positive reaction tells me that there might be something going on this side of his foot. So now I'm going to really check along here for swelling at the coronet band. And if you put your foot down and behave right there, thank you. If you notice, I'm pressing here on the side, and maybe there's a little bit of puffiness, but I really feel something soft right in this area here. So, and when I can feel the tissue underneath, but when I get here, I feel like a little pocket. So my gut instinct is that if he's going to blow an abscess, it'll probably be in this area right here, which directly correlates down there. So even though I really don't feel, I don't feel any real obvious signs on the outside of his foot. His hoof tests positive for pain, especially on the outer part. So the good news, I don't think this is an emergency vet situation. We don't have heat, swelling. We don't have any signs of injury on the foot. I am not a vet. That does not mean he doesn't need vet attention, but most people would like to wait a couple days to see if it gets better or worse. There is something we can do, though, if it is an abscess, to help draw it out. So what I'm going to recommend, if he were my horse, I would take that foot and I would soak it in a warm Epsom salt bath. They make soaker boots. Some people use buckets. Other people use garbage bags that they tie off with baleen twine. I suggest a soaker boot. You use warm Epsom salts water, put the foot in the bucket or the boot, and let it sit and soak it for 15 to 20 minutes. And do that a couple times a day. The other thing you can do is you can wrap the foot, if they're really, really sore on it, you can wrap the foot with a baby diaper, gauze, vet wrap, and bandage the foot and use an Ixamol salve on the area, on the bottom foot and on the top of the foot, and it's a drawing salve. It'll draw out infection. So those are two things you can do. Given the fact that he seems to be feeling better and he's able to get around without hurting himself or limping very often or very badly, I'd just leave the foot bare and I would soak it a couple times a day, morning and evening, until which time something happens. Either he gets better or he blows an abscess. Now, one thing to remember with soaking, if the abscess blows up here, which is called a gravel, or under the foot, you need to stop soaking, because that pus, that bacteria, can cause skin infection if it gets into a wound or into the skin. You just stop soaking. You try to keep it open and clean, wipe it with a soft rag so that everything comes out, and then you're good to go, and it'll heal up on its own. So that's what I would do if Buddy were my horse. And obviously, if you're really concerned, if he's not getting better and it's been 3 or 4 days, then I would take him to the vet and have him checked out. Okie doke.
Thank you.
All righty. Video's done, and I hope if you like the video, you will hit like and also subscribe so you get notifications of upcoming videos on any horse-related topics. Do you have a question? Do you have comments about what you saw? Maybe you want to send me your own video question. Make sure you include your horse in the background. You can send me a video via email or a comment via email at HOOF-RX@gmail.com. Or you can leave your question right here on my channel, Hoof-RX, and just leave it in the comments section. Okay, until next time, stay healthy and happy trails.